Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. The topic is psychosocial integrity. Bereavement may be defined as Option A. Postponing awareness of the reality of the death. Option B. The socially acceptable expression of a loss. Option C. The period of mourning after a death. Option D. The physical symptoms in response to a loss. Right answer is Option C. The period of mourning after a death. Bereavement is the period of grief and mourning following a loss or a death. Grief is normal, experienced as a mental, physical, emotional, and social reactions. There is no timeline for how long bereavement lasts. Factors involved include closeness to the deceased person, cause of death, and presence of support. The goal of the bereavement period is to learn to move forward without the person who has died. When helping a person through grief work, the nurse knows. Option A. A person's perception of a loss has little to do with the grieving process. Option B. Most clients want to be left alone during grief and the nurse should support this desire. Option C. The grief stages may occur in order, they may be skipped, or they may recur. Option D. Coping mechanisms that were effective in the past are often disregarded in response to the pain of a loss. Right answer is Option C. The grief stages may occur in order, they may be skipped, or they may recur. Grief is manifested in a variety of ways that are unique to an individual and based on personal experiences, cultural expectations, and spiritual beliefs. The sequencing of stages or behaviors of grief may occur in order, they may be skipped, or they may recur. The amount of time to resolve grief also varies among individuals. An 82-year-old patient diagnosed with delirium approaches the nurse, worried that she is late for her dental appointment. "I never miss a checkup," she says. The nurse's most appropriate response is Option A. "Let's go to your room and I will show you how to brush your teeth." Option B. "You can't leave because the door is locked so you can't get lost." Option C. "You're in the hospital right now. My name is _ one of the nurses." Option D. "It's nearly lunchtime. You'll want to eat before your appointment." Right answer is Option C. "You're in the hospital right now. My name is _ one of the nurses." Clients with a diagnosis of delirium are easily confused about time and place. The nurse should calmly orient the client with date, time, place, as well as introducing themselves. The other options do not address the disorientation. In fact, pretending the client has an appointment reinforces the confusion. A terminally ill patient tells the nurse, "I'm afraid I won't be allowed into heaven." What is the nurse's most appropriate response? Option A. "What do you usually do when you're afraid?" Option B. "Let me call the chaplain to talk to you." Option C. "Don't worry, I'm sure God understands." Option D. "Can you tell me why you feel that way?" Right answer is Option D. "Can you tell me why you feel that way?" When a patient expresses fear or concern, assess the situation before assisting with a solution. This client may have other fears beyond impending death. Ask a few questions to determine the best resource. A chaplain may be helpful, but do not assume the fear is spiritual. Past coping methods may also be useful. Telling a client not to worry is inappropriate. Which statement would best explain the role of the nurse when planning care for a culturally diverse population? The nurse will plan care to Option A. Provide care while aware of one's own bias, focusing on the client's individual needs rather than the staff's usual practices. Option B. Include care that is culturally congruent with the staff from predetermined national data. Option C. Blend the values of the nurse that are for the good of the client and minimize the client's individual values and beliefs during care. Option D. Focus only on the needs of each client demographic, ignoring the nurse's beliefs and practices. Right answer is option A. Provide care while aware of one's own bias, focusing on the client's individual needs rather than the staff's usual practices. Without understanding one's own beliefs and values, a bias or preconceived belief by the nurse could create an unexpected conflict or an area of neglect in the plan of care for a client, who might be expecting something totally different from the care. During assessment, values, beliefs, practices should be identified by the nurse and used as a guide to identify the choices by the nurse to meet specific needs/outcomes of that client. A client's family member says to the nurse, "The doctor said he will provide palliative care." What does that mean? The nurse's best response is option A. The goal of palliative care is to find the cure for a serious illness or disease. Option B. Palliative care aims to relieve or reduce symptoms of the disease. Option C. Palliative care is given to those who have less than 6 months to live. Option D. Palliative care means to focus on the client's physical needs in the hospital setting. Right answer is option B. Palliative care aims to relieve or reduce symptoms of the disease. Palliative care is specialized medical care with the goal of prevention, relief, reduction, or soothing of symptoms of the client's disease or disorder. There is no specific time frame, nor is there an effort to cure the client. Often, care takes place in the client's home, with support for the entire family. The home health nurse visits an elderly client who has suddenly developed delirium. What should the nurse assess for first? Option A. Congestive heart failure. Option B. Increased hearing loss. Option C. Drug intoxication. Option D. Cancer metastases. Right answer is option C. Drug intoxication. Drug intoxication, from prescription or OTC medications, is more common in the elderly, due to slower metabolism and absorption. Combinations of digoxin, diuretics, analgesics, and anticholinergics should be examined. The other options can lead to delirium, but onset is gradual. A client has recently been told he has terminal cancer. As the nurse enters the room, he yells, "My eggs are cold, and I'm tired of having my sleep interrupted by noisy nurses." The nurse may interpret the client's behavior as option A. The result of maturational loss. Option B. An expression of the anger stage of dying. Option C. An expression of disenfranchised grief. Option D. The result of previous losses. Right answer is option B. An expression of the anger stage of dying. In the anger stage of Kubler-Ross's stages of dying, the individual resists the loss and may strike out at everyone and everything, in this case, the nurse. A dying person will lose everything and everybody that is important to him, and is entitled to feel angry. The daughter of a 74-year-old female client with early-stage Alzheimer's disease, AD, tells the nurse, "I'm so tired of hearing mom talk about the past. It's the same old stories." The nurse's best response is option A. She has lost her short-term memory, but can still remember events from long ago. Option B. You should be more patient with your mother, and accepting of her disease. Option C. She's quite anxious at this stage. Reliving the past helps her become calm again. Option D. Just remind her when she repeats herself. That will reinforce better behavior. Right answer is option A. She has lost her short-term memory, but can still remember events from long ago. Family members can become frustrated when clients with Alzheimer's disease lose short-term memory. AD begins in the hippocampus, deep within and part of the temporal lobe of the brain. The hippocampus is the structure responsible for creating new memories from experiences. When it is damaged, short-term memory is not possible. During an admission for alcohol dependency, the nurse obtains the history from a client with multiple convictions for DUI, driving under the influence. The client admits to having a few drinks a day with my friends. What is the nurse's most appropriate response? Option A. It looks like your alcohol tolerance has gone down. Option B. Can you explain how few drinks led to multiple arrests? Option C. Why didn't you get a friend to be the designated driver? Option D. That's what every single person in treatment claims. Right answer is Option B. Can you explain how few drinks led to multiple arrests? The nurse should not minimize the serious effects of alcohol abuse. Clients must acknowledge the consequences of their behavior in order to begin recovery. Thanks for watching. If you like our video, then do like, comment, share. Subscribe our channel for regular updates.